Hello, today we are going to talk about the trochlear nerve. Let's talk about it from the starting. It arises from the midbrain as the third cranial nerve we discussed arise. Okay, this is the anterior side, this is the posterior side, and this is the cerebral aqueduct. Okay, and around it, it's the cerebral that gray matter, periaqueductal gray matter. Okay, here it's a white matter, that is superior medullary velum. Okay, it's a white matter, and here there is a ridge over here. This is a band of white matter behind that, and this is the frenulum villi. This is a ridge. Okay, so this is the midbrain, and this is at the level of inferior colliculus. Okay, third cranial nerve is at the cross-sectional level of fourth, at the level of superior colliculus, and it is at the level of inferior colliculus. So if I show you in side view, okay, here is the okay, this is a cerebellum, and this is the superior colliculus, this is inferior colliculus, and here this part, this is superior medullary velum. Like, this is a inferior colliculus level, and here it's cerebellum. Above it, it's this superior medullary velum. This is the white band. So the fourth cranial nerve nucleus is lateral to this. Here, this is the fourth cranial nerve, and there is one speciality of trochlear nerve. What is the speciality? There's other cranial nerves travel anteriorly, okay, direct anteriorly, but this fourth cranial nerve has a route like this. It firstly goes behind, okay, it crosses, and then it comes in front. This also, it crosses, sorry, this one crosses and goes there, and this nucleus crosses and goes there. Like, the nerve fibers from this nucleus crosses here and goes there. I've made it, okay, like this. So they go to the contralateral muscles, which they are going to like this is suppose left side, so left side nucleus will supply the superior oblique muscle of the right eye. One more feature of this trochlear nerve is that it has the least number of neurons, okay, and third function, which I told you, that it supplies the contralateral superior oblique muscle. First was it emerges from the back, second was it has the least number of neurons, third it supplies the contralateral superior oblique muscle. Okay, so if I make the anterior cranial fossa, this middle cranial fossa, posterior cranial fossa, like this, okay, it will go little up, and then it will go down from here. This is foramen magnum. From here it is coming down. Okay, suppose this is the middle, this is middle, this is posterior. Here there is cavernous sinus. Okay, here there is the cavernous sinus. From here, this is the fourth cranial nerve. Here it's a third cranial nerve. Here it's a fourth cranial nerve. It will go like it will go from behind and go up. Like, it will go behind and then it will go ahead. So here, as we discussed yesterday, that fourth cranial nerve, it enters the lateral wall of the cavernous sinus. This is the cavernous sinus, and it's a lateral wall. This is the third cranial nerve. This is sympathetic fibers. These are the parasympathetic fibers, and this is the somatomotor fibers. Okay, and this third one, this is the fourth cranial nerve which is passing. Okay, if I tell you more detail, okay, this is the lateral wall. Okay, and from here comes the third cranial nerve, which is ahead of it. Here is the fourth, this is third, this is the fourth one which is coming. So at the start, third one is above it and fourth is below it, and then goes the superior division, and then goes the inferior division of third cranial nerve. But the fourth cranial nerve, like this, I'll show you. This is the fourth cranial nerve. It goes above the superior branch, like it crosses and goes above. So fourth cranial nerve emerges at the top of the third upper part also. This is the third superior part, this is third inferior part, like superior branch and inferior branch. After this cavernous sinus, it reaches the superior orbital fissure. Through it goes in the orbit here. Okay, so this is a tendinous ring. From here the muscles arises, takes origin. Okay, and this is the superior orbital fissure. This is the orbit ahead of it. Okay, so this is LF. This is fourth cranial nerve. You can say T. You can say T. T for trochlear nerve. L is lacrimal. F is frontal nerve, lacrimal nerve. This is trochlear nerve. This lacrimal frontal is the branch of ophthalmic nerve of trigeminal fifth cranial nerve, lacrimal frontal, and this nasociliary. Okay, so you can say it LFT. LFT, that is liver function test. This is liver function test. You can do it as a mnemonic. LFT. Outside the tendinous ring it goes LFT. Okay, it had longest intracranial course. As I told you, it goes behind and then ahead. And sixth cranial nerve, which we'll discuss later, has the longest intradural course. Okay, so if I'll talk about its innervation, so this is, I'm making the eye. Okay, here it from this tendinous ring, it arises and goes here like this. This is the superior rectus. Okay, then comes this one, and this is going where? This is the eyelid. Okay, so it is going here. This is levator palpebrae superioris. Okay, this we discussed in last video. It has two parts. One is the involuntary, that is muscle of Muller, and one is this. And third one is our superior oblique muscle. It has, one is like this. First it comes and then it crosses and it goes like this, goes to the sclera of the eye. This is what? This is the superior oblique. As we discussed, superior oblique, fourth cranial nerve, SO4. Okay, this is a mnemonic. So S, superior oblique, is like this. So how it works? When it is contracted, okay, it will stretch from behind. Okay, when it is contracted, it will go behind, and this part will go above. So when this will go above, the eye will depress. So are you getting it? It's going behind, it's going above. It's like this. Okay, so if it is going above, this will move, eyeball will move down. So it is a depressor of the eye. From the back of the eye, it elevates, because it's okay. From the back of the eye, it elevates the superior oblique, and from the front, it depresses. Here it elevates, here it depresses. Okay, so this is its function. It has one more function. It can intort the eye. Intort. What is intorsion? Intorsion is spinning of the eye towards the nose side. Extorsion is spinning of the eye outside. Okay, like if it's a normal eye, okay, this side, and this is the nose. Okay, so intorsion is this side and extortion is away from the nose. Okay, this side, this is extorsion, this is intorsion, this is normal. It also moves the eyeball, rotates it laterally to the lateral side. So it has three functions. It moves the eye down, out, and intort. Intort is spinning of the eyeball inside. When fourth cranial nerve is damaged, then these three functions are damaged. So when this is damaged, there are two types of diplopia. One is the vertical diplopia. Diplopia means die of plopia. Plopia means vision and die means two. Two visions are there. So firstly talk about the vertical diplopia. What happens in vertical means like this. Okay, so what happens when the fourth cranial nerve is damaged, or in the suppose one eye. So if you ask the patient, this is eye, to look As we know, the fourth cranial nerve had three functions: down, it looked down, it's out, and intort. These three functions was there: down, out, and intort. Intort is spinning. So if we talk about this down function, so if we ask the patient to look down, suppose this eye is damaged, so this eye cannot look down and this will look down. Okay, so the person, this kind of, there will be two visions. So that is the vertical diplopia. In a vertical direction, one is moving, eye is looking above, one is looking down. So this will cause a vertical diplopia, two visions for the patient. Then there is horizontal diplopia. Okay, what happens in horizontal diplopia? Now in horizontal we discuss about intorsion. If we ask the patient to look at that side, or see some in the normal eye, it's normal. In the normal eye, your vision is this above. Okay, like this, your vision is. When your eyes are tilted, like they are tilted. So if your head is straight, in the normal person, this is the vision, this is the vision. Okay, this is straight upwards. Okay, when you tilt your head like this, so if you want to see above, like this vision, if you want to keep this vision only, then this eye will intort, and this eye, which was like this, okay, this side will intort, and like this, and this side, that will extort out. Like earlier it was like this. Okay, so this eye tilted that side, so for this vision only, like this head tilted this side like this, so for the upper vision only, this eye had to extort, and this eye inside the nose, like, so it has to intort. Are you getting? So it will move. So if you move your head like this, okay, like this, so to keep the vision this only, what you did, now this eye extorted and this eye intorted. Okay, but if the fourth cranial nerve is damaged, then you cannot intort your eye. Like here, if this intorsion cannot happen. Okay, suppose this eye, this is the right eye, this is the left eye, so this eye will extort. This eye is moving up like normal. When two obliques, like superior oblique and inferior oblique, are working simultaneously, like one is intorting and one is extorting, then you can look like straight. But if one is not working, as you can see this, so it will extort due to the inferior oblique. Okay, it will extort in the normal condition, so it has this vision. So to correct it, for the patients has a tendency to keep their head tilted. How they will keep their head? They will keep their head like this, in this direction. This eye is normal, this eye was damaged. Okay, so this eye can intort, so it intorted, and this eye can extort. So now there is this vision is normal. Okay, so the people who have the fourth cranial nerve damage, they have the tendency to keep their head tilted towards contralateral side, which has been damaged. Like here, right cranial nerve has damaged, fourth cranial nerve, so they has a tendency to tilt their head towards the left side, because that side eye will intort and this is extorting, so they will have this clear vision. So this was about trochlear nerve. Thank you.